Good morning, everybody, or good afternoon, I should say. Thank you for taking time to join us today. We wanted to help you learn a little bit more about the COVID-19 vaccine and have an opportunity to ask a medical professional questions that you may have about the vaccine. The Q&A is meant to answer questions about the vaccine and address concerns that you may have. It's really not meant to be about Telamon policy. But if we have time at the end, we'll address the questions around that as we have time. So I want to take a minute and introduce our special guest today. Dr. Larry Mathers graduated from the University of Pittsburgh School of Medicine in 2000. His mentor and advisor was Dr. Richard Zimmerman, who previously chaired the Adult Vaccination Working Group of the CDC's Advisory Committee on Immunization Practices. And during his residency, Dr. Mathers received training in preventative care and immunization practices. He's worked for Rural Medical Services, a federally qualified community health center in Newport, Tennessee since 2003, where he provides clinic and hospital-based care for adults, children, and expected mothers. In this role, he routinely cares for families served by Telamon and regularly administers vaccines against nearly 20 preventable diseases to patients of all ages. He's been happily married for 25 years. They have 2 wonderful children who've been raised bilingual, and he is heavily involved in his local church. He coaches youth swim and soccer teams and supports several other community organizations. So Dr. Mathers has served on medical mission trips in Mexico, Ecuador, Venezuela, and Guatemala, and he speaks Spanish fluently. So while we will be conducting this session primarily in English, feel free to send questions or ask him to explain something in Spanish. El doctor habla español también, por lo tanto, aunque conduciremos esta sesión principalmente en inglés, no dude en enviar preguntas o pedirle que explique algo en español. Dr. Mathers has been provided the questions we received in advance, so thank you for sending those in. He's going to incorporate those answers into some of a brief presentation, and then we'll open it up for questions that you may have in addition to that. So because of the number of people attending this webinar, everybody is on mute. If you have questions, please type them into the chat box, and we'll try to ask and answer those, as many of those as we have time for at the end of the hour. I do also have one of our corporate team members, Tim Popama, who's going to be assisting and monitoring the questions coming in as well. So Dr. Mathers, we're happy to have you here with us today and appreciate your time and expertise on the topic of COVID vaccines. I'm going to shut my camera off so people pay attention to you, and we'll go from there.
Thank you, Suzanne, and good afternoon to everyone that is attending. I appreciate you taking the time this afternoon as we are here to discuss a little bit about common questions and concerns about COVID-19 vaccination. As Suzanne said, I'm a family physician in Newport, Tennessee. I've been here for 18 years, and in my practice, I take care of adults and children, expectant mothers. I care for them in the hospital and in the clinic, and as part of my practice, routinely provide immunizations for nearly 20 illnesses that are preventable by vaccine, including COVID. We have a fair amount of experience in our practice taking care of patients who've tested positive for COVID, and a fair amount of experience with administering the COVID vaccine. I appreciate everyone joining this afternoon. I just want to say thank you for your service to your communities. We have Telamon and Head Start here in East Tennessee, and the service provided to the people of our community is a great service, and I appreciate the time and the effort that each of you give to your communities where you are. As Suzanne mentioned, I am fluent in Spanish, and will be happy to field questions via the chat in English or in Spanish. And if there's a specific question that you would like me to address in English or Spanish, please feel free to put that in. I'm going to start today by talking a little bit about COVID-19 itself and the rationale for vaccination. And then I will talk about the vaccine, what we know about its safety, what we know about its side effects, what we know about its efficacy. And I'll answer a couple common questions or common concerns that I hear every day as I'm taking care of patients and offering to vaccinate them.
I'm sorry, Dr. Mathers, I'm not sure if everybody else is seeing it. I'm not seeing your camera. Have you shared your camera?
Okay. My
Or can
webcam
somebody?
says that it's showing, and I have
Okay,
an image of myself there at the top of the screen.
okay.
Yes, I can see the camera as well.
All right. Thank you. Sorry about that.
No problem. So I'll start out by talking about COVID, the disease, because to understand why we are recommending a vaccine, it's important to understand the disease that we're vaccinating against. As most people know, COVID has been rampant in the world and in this country over the past year and a half. If we look at United States figures alone, just to lend some perspective to the pandemic, there have been 45 million cases of COVID diagnosed in the US alone since the start of the pandemic. 45 million, that equates to about 1 out of every 7 Americans has been diagnosed with COVID since the pandemic began. This is a frighteningly frequent infection. We also know that it is a severe infection that many have died. 725,000 people in the United States alone, and nearly 5 million people in the world have died since the pandemic began from COVID. If you look at the numbers, what that equates to is about 1 out of every 500 Americans has died from COVID in the past 18 months. It is currently the #2 cause of death in the United States. And obviously, there have been waves of the pandemic. We're in the 4th wave right now. And what we see is that we're still seeing about 86,000 cases of COVID being diagnosed across the US every day. And about 1,600 people per day are still dying from COVID. So COVID's here. It is still infecting people. It is still killing people. And as many of you know, friends, family members, you may have seen get sick or die in the past year and a half from this. When we look at COVID right now, we know that there are significant risks associated with the infection. We know that about 2 to 3% of people who contract COVID end up in the hospital. They end up sick enough that they have to go to the hospital for oxygen treatment or ventilation or other treatment. And we know that approximately 1 to 1.5% of people who contract COVID die from it. Now, granted, that's more common in individuals who are older and or have chronic illnesses, but we have seen young adults and tragically children die from COVID over the past 18 months. Another thing about COVID that's important to understand, it's not just the risk of hospitalization or death, but there's also the risk of what's commonly referred to as long COVID. If you've not heard about this, long COVID is a term that we use to describe lingering symptoms that persist after somebody recovers from the initial infection of COVID. And ongoing medical studies show that up to a third, perhaps even 1/2 of patients still have some lingering symptoms from their COVID infection 6 months after their diagnosis. Some of these symptoms include long-term loss of taste or smell, brain fog or difficulty thinking clearly, fairly profound fatigue, depression, shortness of breath, lack of energy, some GI symptoms. So again, a lot of people look at COVID and they say, well, for a lot of people, it's like a common cold. And it's true. For the majority of people, COVID is like a bad common cold. It causes cold symptoms, runny nose, sore throat, cough, fevers, body aches, and they get over it. But a third to a half of people develop symptoms that linger for several months. Again, about 2 to 3% of people end up in the hospital, and about 1 to 1.5% of people end up dying from COVID. So we can see that this is a significant disease, has significant morbidity and mortality associated with it, and therefore it's reasonable to talk about vaccinating against it. We know that there are 3 vaccines available in the United States against COVID-19. One is from Moderna, another is from Pfizer, and a third is from Johnson & Johnson. And I'll be talking about each of these vaccines through the rest of the presentation. It's important to know that to date, there have been over 400 million doses of vaccine administered. The vast majority of them have been the Moderna and the Pfizer vaccine. There have been about 15 million doses of the Johnson & Johnson vaccine administered. And the reason I think that's so important is because it gives us a very robust database to look at in terms of safety and efficacy. In other words, we have a lot of information that we've gathered over the 18 months since the pandemic began and since we started studying and administering these vaccines about 15 months ago. We have a lot of information that we can look at to see how effective they are and to see how safe they are. So I'd like to talk a few minutes about the safety of the vaccines. It is very reasonable for all of us to exercise great caution when a new vaccine comes out and is available, especially when it's using new technology. We want to know, understandably, before we put something in our bodies, is this safe? Is this something that is going to help me, or is this something that's going to harm me? And I want to summarize for you briefly what we've learned about these vaccines over the 15 months or so that we have been administering them. Again, this is data collected on over 400 million doses of vaccine. And I emphasize that because, again, we're not talking about having just given a few hundred or a few thousand or even a few tens of thousands of vaccines and wondering what's going to happen. We've administered over 400 million doses of these vaccines. So we have a lot of information to pull from. First and foremost, I think it's important for everyone to understand that what we're seeing with these vaccines is that there are no late onset or long-term side effects from the vaccines. And what I mean by late onset is that with vaccines historically and also with the COVID vaccines, if there's going to be an adverse reaction, if something bad is going to happen, it usually happens within days to weeks of the vaccine being administered. Historically, there's really no precedent for significant adverse effects from vaccines occurring many months or years after a vaccine is administered. If a vaccine is going to cause a problem, it causes a problem right away. And as I've half-jokingly told many of my patients over the last couple months, if any of the COVID vaccines were going to cause us to grow a second head or a third arm, we would have seen it by now. This is not something that is likely to cause any adverse reactions many months or years after it's been administered. And again, intensive data monitoring, intensive safety monitoring has shown no late onset and no long-term side effects from these vaccines. I think it's important to understand that not only have we administered 400 million doses, but the safety monitoring for these vaccines is the most intense in history. Other vaccines that we commonly administer are also monitored, but no other vaccine on the planet has been monitored with the intensity that these vaccines have been monitored over the past 15 months. Talking more about safety, it is important to be completely transparent about side effects from the vaccine. And in terms of safety concerns, there really are 4 identified safety concerns with the vaccines. I'm not going to sit here and say that any vaccine is completely free of risk. And that's true with any vaccine that you may have ever received. You may have gotten a tetanus shot, a flu shot, a hepatitis shot, a pneumonia shot, childhood vaccines in the past. No vaccine is without risk. And again, that's true with the COVID vaccines. But what are the risks that we're talking about? And I'm going to give some numbers. I don't want to drown people in numbers, but I think numbers help to lend perspective to what we're talking about. So first of all, in terms of adverse reactions that have been noticed with these vaccines, the first is a severe allergic reaction, or what we call anaphylaxis. This is a severe enough allergic reaction that somebody ends up going to the emergency room, ends up in the hospital, gets a dose of epinephrine, or has to be treated with respiratory or cardiovascular support. And what we're finding with our data tracking is that the risk of anaphylaxis, a severe allergic reaction to any of the COVID vaccines, is somewhere in the ballpark of 2 to 4 cases in 1 million vaccines. So out of 1 million people who receive the vaccine, 2, 3, 4 of them may end up having an allergic reaction severe enough that they have to seek medical care for it. In the news, you may have also heard about a few other safety concerns with the vaccines. One is a condition called Guillain-Barré syndrome. This is a neurologic condition where the immune system attacks the nervous system and can result in weakness, muscle weakness, or even difficulty breathing. We have noticed with the Johnson & Johnson vaccine, and again, that's the least common vaccine that's administered, but it is a vaccine available in the United States. There have been about 225 cases of Guillain-Barré syndrome reported after vaccination. And again, that's among 15 million vaccines administered, which translates to about 1 person in 66,000. So of 66,000 people that get a Johnson & Johnson vaccine, 1 may develop Guillain-Barré. Another safety concern that has been in the news is that of blood clots. You may have heard that with the Johnson & Johnson vaccine, there were some case reports of individuals developing blood clots within days to weeks of having received the vaccine. Again, tracking those cases very meticulously, what we're finding is the rate of blood clot with the Johnson & Johnson vaccine is approximately 1 in 320,000 people. So again, of 320,000 people that get a Johnson & Johnson vaccine, 1 may develop a blood clot. And the data show that that's most typically in women who are less than 50 years old. Does not seem to be as much an issue in older women or in men. And perhaps the safety concern that's gotten the most press recently is that of myocarditis or heart inflammation. This is an issue that has been reported with the Pfizer vaccine and the Moderna vaccine, both of which are based in mRNA or messenger RNA technology. And what we see from our data tracking with these vaccines is that there are cases of myocarditis reported in about 1 out of every 425,000 vaccines that are administered. Again, 425,000 people get a Pfizer or Moderna vaccine. 1 of them may end up with a case of myocarditis. The cases that do come up after vaccination tend to be mild, short-lived, treated symptomatically with full recovery. It is more common in adolescent males compared to females or older males. So this is coming into discussion as we're talking about vaccinating children and adolescents. The myocarditis discussion has come up. Again, I want to emphasize that the rate of myocarditis that's being reported is 1 in 425,000. And it's worth comparing with the fact that if you're infected with COVID, the rate of myocarditis from infection with COVID is 1 or 2 in 1,000. So the risk of myocarditis from COVID itself is several-fold higher than any concern about myocarditis from the vaccine. So overall, a very good safety profile. As I said, I'm not going to say that there's 0 risk associated with these vaccines, but the numbers, I think, speak for themselves, that when we talk about severe allergic reaction, we're talking about 2 to 4 in 1 million. Guillain-Barré, we're talking about 1 in 66,000 doses of J&J. Blood clots, we're talking about 1 in 320,000 doses of the J&J vaccine. And with myocarditis, we're talking about 1 in 425,000 people getting a messenger RNA vaccine like Moderna or Pfizer. Now, there are common side effects of these vaccines. And again, I want to be fully honest and completely transparent about what we're seeing with the side effects from the vaccines. About 50 to 60% of people who get vaccines, and especially with the Moderna vaccine, and to a lesser extent with Pfizer and J&J, have some short-lived mild side effects, such as a sore arm, body aches, feeling feverish or flu-like, having some transient or temporary cold symptoms. These usually last anywhere from about 12 hours to 48 hours and resolve on their own. And again, I want to emphasize no long-term side effects or long-term safety concerns. These side effects from the vaccines are more common after the second dose of Pfizer or Moderna, though some people also feel rough after the first dose, but that is much less common. So if you're considering getting vaccinated, it's not a bad idea, especially after your second dose, to take it on a day that you can rest and recover the next day if at all possible. But again, you can expect that even if you do feel rough for a day or so after the vaccine, you should be back to your normal self within about 24 to 48 hours. Now that I've talked about the risks and some of the common side effects of the vaccines, let me talk for a couple minutes about the effectiveness of the vaccines, because that's the other important component. We know that COVID itself is dangerous. We know that it presents several risks. We know that the vaccines, by and large, are safe. I won't say they're zero risk, but they are very low risk, and the side effects with them are generally short-lived. But it's also important to know if we're going to put something in our bodies, we want to make sure that it's actually working and helping us. And there's a lot of confusing information out there and a lot of apparently contradictory information. So I want to try to take all of the information that's out there and give a balanced view on how effective these vaccines are. If we look at all of the vaccines and we look at all of the data on the effectiveness of the vaccines, the important things to know about it. First of all, it decreases your risk of dying from COVID. There's no question about it that unvaccinated people who catch COVID are much, much more likely to die than people who are vaccinated. Studies show that those who are unvaccinated and contract COVID are 11 times more likely to die from COVID than somebody who is vaccinated. So while taking a vaccine does not completely eliminate the possibility of dying from COVID, and in fact, if you follow the news, you know that Colin Powell just died. He's in his 80s. He had multiple myeloma. He was vaccinated, but he contracted COVID and he died from it. So there are cases where people get vaccinated, and because they're older or they have chronic illnesses or immunosuppressing conditions, they still succumb to COVID. The vast, vast, vast majority of people who are vaccinated are well protected against death from COVID. So again, the unvaccinated are 11 times more likely to die of a COVID infection than somebody who's vaccinated. The vaccines also significantly decrease your risk of being hospitalized if you get sick with COVID. The unvaccinated are about 19 times more likely to be hospitalized than those who are vaccinated. So by taking a vaccine, you significantly decrease your chance of being hospitalized with COVID. Getting vaccinated also decreases your risk of catching COVID. And this is important to know because there's a lot of noise in the news and on social media right now about people who are vaccinated and still catch COVID. It is true, and I've seen it in our clinics and in our hospital, that some of our patients who are vaccinated still end up infected with the COVID-19 virus. But what we know is that if you're vaccinated, your chances of getting COVID following an exposure are decreased about sixfold. So the unvaccinated are 6 times more likely to get clinically sick with COVID after an exposure than those who are vaccinated. They've done fairly interesting studies where they've looked at people who have had very similar exposures or the same exposure to someone who's sick with COVID. And again, the vaccinated folks are significantly protected. The unvaccinated folks are 6 times more likely to get sick with COVID following the same exposure. Getting vaccinated also has other benefits for the community. Some of us get vaccinated for ourselves. Some of us get vaccinated for our children. for our coworkers, for our family, for our church community, for others in the community. It is important to know that getting vaccinated also decreases your chances of spreading COVID by about 65%. Again, it doesn't completely eliminate it. And so I know there are some people who say, why bother getting a vaccine if I could still get COVID or if I might still spread it? True. You may still get COVID. You could possibly spread it, but the chances of it are significantly decreased. By getting a vaccine, you decrease your chances of spreading a COVID infection by about 65%. Interestingly, getting vaccinated also significantly decreases your chance of having those long-haul COVID symptoms that I talked about a few minutes ago. Remember, I said that upwards of 50% of people who are diagnosed with COVID still have some type of COVID symptoms 6 months later. Those who are vaccinated, that number's cut in half. So vaccination decreases your risk of long-haul COVID symptoms by 50%. And the current vaccines are effective against all strains of COVID at this time. We had the Alpha strain in this country as the predominant strain early in the pandemic, and of course the last several months we've been dealing with the Delta strain. There was some initial concern that Delta might escape vaccine coverage, but the vaccines are still shown to be very effective against infection and hospitalization and death and spreading COVID and long COVID symptoms. So the vaccines that are available from Moderna, from Pfizer, from J&J provide significant benefit. I'm going to address a couple common questions that I get in the clinic, and then I'll turn to the questions that you have already submitted to the Telamon office and try to address those individually. And again, I'm happy to take questions by chat. Y como mencionó Susan, yo hablo español. Si tiene alguna duda, algo que no entendió, con mucho gusto puedo explicar cualquier duda que tenga si quiere enviarme algo por el chat. So some common questions that I face here in the clinic and get all the time as I'm talking with patients and talking with organizations in our community. One question I get is it possible that the vaccine will give you the COVID virus? And the simple answer is no. The vaccine technology does not use the virus itself. And so it is not possible for the vaccine to give you COVID. As I mentioned, it can make you feel rough for a day or two. You may feel flu-like or COVID-like for 12, 24, 48 hours after getting vaccinated. But the vaccines that are available do not give you COVID, the disease. I get questions all the time about vaccinations altering our DNA. Two of these vaccines are messenger RNA vaccines. Another vaccine is the J&J is a DNA vaccine encapsulated within another virus, an adenovirus. None of these vaccines interact with your cellular DNA. None of these vaccines alter your DNA. These vaccines enter the cell, they're processed by your cellular machinery, and they disappear within a matter of a few days. So there's no lingering genetic material, there's nothing taken up into your chromosomes, into your DNA. There is no alteration in your DNA from any of the available vaccines. There's some questions that I get about whether these are metallic vaccines. There is no metal in any of the ingredients of any of the approved vaccines. They do not contain metal or microchips. They do not make you magnetic. And there are understandably some questions about fertility. Men and women alike have asked me whether the vaccines have any evidence of altering fertility. And so far, there is no signal of any alteration in fertility in men or in women. And as I said earlier, in the history of vaccination, there's no precedent for any vaccines causing adverse effects beyond the first few days or few weeks after the vaccination. And we have 15 months of data on over 400 million vaccines that we're looking at. A couple other final questions that I get, and then I'll turn to the questions that you guys have submitted. Another common question that I get is, why get vaccinated if I've already had COVID? And this is a very reasonable, very good question to ask. And there's a lot of smart people asking about whether or not vaccination is necessary for people who have already recovered from COVID-19. The short answer is that natural infection generates such a wide variety of antibody responses. Some people have a very mild infection and a minimal antibody response. Some people have a severe infection and still a minimal antibody response. Some people have a mild infection and a significant antibody response. Some people have a severe infection and a significant antibody response. And right now, we just don't know for sure how long immunity from natural infection lasts. Preliminary studies were guessing about 3 months, but as the pandemic has worn on, we're finding that some people still have immunity at 8 months or 12 months after infection, but some people don't. And there are cases of people getting reinfected after having recovered from COVID. In fact, I had a patient last year who had a case of COVID. It was mild to moderate. He recovered, and 3 to 4 months later, he got another case of COVID and he died from it. He was a younger individual that we wouldn't have expected to have died from COVID. So people who recover from COVID do have some degree of immunity, but it's variable. And the surest way to get a predictable level of immunity and an enduring level of immunity is to go ahead and get vaccinated sometime after you've recovered from COVID. Some people say, well, why get vaccinated if I might get COVID anyway? This usually comes from folks who've seen in the news or have heard from friends or know of people who got vaccinated and then they got a case of COVID. And again, this goes back to the discussion that I had earlier that although vaccination does not eliminate the risk of getting COVID, it significantly decreases the risk of getting COVID, of getting very sick with COVID, of dying from COVID, of having long haul symptoms, and of spreading or sharing COVID with other people. So getting vaccinated helps to minimize your risks from COVID if you are exposed to it or if you do get sick with it. Another question I've begun to get recently is if these vaccines are effective, then why are we talking about booster doses? And are we going to have to get a booster dose every year? And I think the short answer to that is that the vaccines are effective. Again, these are the most intensely scrutinized and most intensely studied vaccines in the history of humanity. And because of that, we're monitoring very closely antibody levels in the months following vaccination. And because we are starting to see some waning antibody levels, especially in older individuals and those with chronic health conditions, the public health authorities thought that a booster dose would help to reinforce your antibody levels. So again, the vaccine's effective, the booster just helps to make it more effective. In terms of the question as to whether or not we're going to need to do this every year, I don't know yet. I think, again, these are being intensely monitored, intensely scrutinized, and I think if with a booster, the antibody levels persist, and if the pandemic winds down and we have lower caseloads, it's conceivable that this year's booster dose may be the final booster dose or final booster dose for a few years. But it's also equally plausible that they'll recommend an annual COVID vaccine, much like we get an annual flu vaccine. So that is something I don't have an answer to, but I think that we can take we can be confident that the public health authorities are looking at this very, very carefully. And final question that I get, part of my practice involves obstetric care. I care for expectant mothers and I deliver babies in the hospital. And I get questions all the time about whether or not the vaccine is safe for pregnant women, whether pregnant women should get the vaccine. And my answer to that is that based on everything that we know so far, the vaccine is very safe in pregnant women. There hasn't been any signal of any adverse effect from vaccination. And in fact, what we're finding is that vaccinating pregnant women helps to prevent them, the pregnant women, from getting severe disease, and helps to generate antibodies that the babies are born with. So babies